Postpartum hemorrhage, End the combat with 4T's plus model. By Chantrapitak W, and Ansakanwat W, Sritipayawan S, Logindarat S, Suwikram S, Wat Luingraran R. Obstetrics and Gynecology Department, Charankrung Pracharak Hospital, Bangkok, Thailand. The new chapter of PPH 4T's is not enough. The question is why? Objectives: to show the importance of lower uterine segment to PPH. To propose a new idea regarding the mechanism of PPH, which is 4T's plus model. To propose a new management of PPH with lower uterine segment compression maneuver. To further build on the existing knowledge about PPH. As we all know, PPH is a major cause of maternal mortality all over the world. World Health Organization had set to reduce the maternal mortality ratio of PPH through millennium Development Goals or MDG 5 between 1990 to 2015, with a target of 3/4 reduction by 2015. However, the end result is disappointing, not even half of the target was reached. World Health Organization thus set a new target through Sustainable Development Goals which carried on from MDG 5, from 2016 to 2030, a total of 15 years. The goal of SDG is to reduce maternal mortality ratio to 70/100,000 slip birth at the end of the project by the year 2030, with no country having MMR more than twice. Despite remarkable overall improvement in maternal mortality ratio of PPH, the goal still remains far from reach. On the other hand, the incidence rate of atonic PPH continues to climb in the last 2 decades, even in a developed country. So, how is atonic PPH important? Firstly, 80 to 90% of total PPH cases are atonic PPH. Secondly, the exact cause of atonic PPH remains unknown. Meanwhile, the effect of the known risk factors is only around 10%. And last, atonic PPH has the highest mortality rate and morbidity rate due to its large proportion to all PPH cases. Most importantly, the incidence rate of atonic PPH is still going up without any sign of stopping. As a result, many questions still remain unanswered about the management of PPH. What do we know, and where do we go to next? What has been done to fight against PPH? In terms of prevention, there is only active management, third stage of labor, in which nearly everyone now knows that its effectiveness is almost all thanks to uterotonic drugs alone. To solve this problem, we mostly tend to focus on treatment, which either consists of pharmacological or surgical intervention. Furthermore, we even turn to special medical equipment for help, such as non-pneumatic anti-shock garment. From this figure, we can see that in this past century many changes are constantly made to improve PPH prevention. But almost none are actually about the way PPH is managed. Similarly, the treatment guideline of PPH remains mostly unchanged, perhaps except for more emphasis on the importance of tamponade and compression suture. So, is there anything else we can do to combat PPH? The answer is there is. Quote. And of course, as always, prevention is better than cure. And always keep in mind that atony is too late. Since active management third stage, if labor cannot achieve a satisfactory reduction in atonic PPH, we suggest a new way to completely eliminate atonic PPH, which is the 4T's plus model. The turning point of this idea is to separate uterine atony into two types to facilitate a more precise problem solving. Either flaccid uterus is a result of uterine overdistension or from medication, which will happen immediately after delivery. The other one is hypoxic uterus, is a result of uterine hypoperfusion, which persists until uterine muscle becomes hypoxic, followed by its relaxation. Four T's plus model. Mnemonic 4T's corresponds to the four main causes of PPH. When we separate uterine atony into two types, we will find out that lower uterine segment bleeding or lower uterine segment atony is the cause of hypoxic uterine atony, which is also the origin of the problem of uterine atony that we see every day, as we know. Nowadays, lower uterine segment bleeding receives more recognition as a cause of PPH. The lower the placenta attaches to the lower uterine segment, the more it will bleed. Four T's plus model thus clearly display the atonic PPH pathways. And all five pathways can eventually lead to the vicious cycle of PPH. Vicious cycle of PPH. The mechanism of hypoxic uterine atony cycle is as followed: excessive bleeding after placental delivery despite good uterine contraction, return to persistent bleeding until more than 1,000 milliliters. That will cause uterine muscle hypoxia from hypoperfusion, resulting in uterine muscle relaxation, and complete the cycle of PPH, that is bleeding, hypoxia, atony, and repeated cycle again. This figure displays a result of an experiment in lab animals. It shows that when smooth muscle, such as uterine muscle, was induced into a hypoxic state by cyanide, it caused a rapid and intense relaxation. Thus, this proves that uterine atony will happen when hypoxia occurs. When we look back to the origin of hypoxic uterine atony, we find out that it is actually caused by lower uterine segment bleeding. Therefore, the solution is to directly compress the placenta bed bleeding site, since oxytocics and uterine massage are ineffective. Lower uterine segment compression maneuver. Both bimanual uterine compression and compression suture are used to treat PPH, which can already be considered late. This is because we should prevent PPH in the first place. And what can help us in this is lower uterine segment compression maneuver. Lower uterine segment compression maneuver is directly beneficial in preventing PPH caused by lower uterine segment atony. Tip: use LUSC immediately in case of abnormally profuse bleeding after placental delivery. The incidence rate of LUSA is low normally. Therefore, it is not necessary to use LUSC in cases without abnormal bleeding after delivery, which also means that there is no LUSA. Therefore, the use of LUSC will has a significant reduction effect on the incidence rate of PPH. Since the past, new research are constantly made to assess the efficiency and effectiveness of lower uterine segment compression, such as this presentation here. This figure shows how to do lower uterine segment compression, which consists of two main techniques. when the maneuver was done correctly, the result can actually be astonishing. The compression should be precisely on lower uterine segment. Apply sufficient pressure. While pronating towards the uterus, use all 4 fingertips to apply pressure. Keep the compression consistent. Be swift. When large amount of blood is observed postpartum, immediate compression will result in decreased blood loss. The sooner, the better. Other techniques on how to perform lower uterine segment compression. As soon as large amount of blood is observed, apply compression immediately. If the uterus still feels soft during the compression, the non-compressing hand should massage the fundus simultaneously. Some mothers may have stretchy abdomen. Two-hand technique is appropriate. For tight abdomen, usually use one-hand technique. Conclusion. It has been decades since the fight against PPH has started worldwide. Even if the situation has seemed to improve for the better, it still remains a major problem for obstetricians, which causes loss of many maternal lives. When we have 4T's plus model, this may be the starting point in eliminating atonic PPH in the near future. Thank you. We would like to thank every patient, every colleague, and Charankrung Prakarak Hospital for helping us in this endeavor in reaching this conclusion. We also would like to thank the authors of every research and article for their data and insight, especially those that have been referenced to in this presentation.